The White House physician says President Biden continues to feel well and described the president testing positive as, quote, unsurprising. I want to bring in epidemiologist and ABC News contributor Dr. Brownstein for more on this. Dr. Brownstein, why is it unsurprising that the president is still testing positive for COVID-19?
Well, good morning, Diane. It's not surprising because it's something that we've discussed. It is an event that occurs among people who have taken this treatment of Paxlovid. It's been reported among people maybe 2 to 8 days after that initial recovery among those who took the drug. But, we have to remember over 3 million people have taken Paxlovid, and there's been no increased risk of occurrence of severe illness, hospitalization, or death. And, when you look at the people who have taken this product, they have 5 times less likely chance of being hospitalized, 10 times less likely to die. So rebounds can happen, but it's really not a reason to avoid, this treatment. The benefits of staying out of the hospital way outweigh any risk of a rebound. So it was super important that he took this product. But of course, we know that these rebounds do happen in the real world.
So how common are these rebounds? And I think they said the president had tested positive or negative for 3 days before then, sort of going out and being around other people. Given these rebounds do happen, how common are they? And do people who get treated this way, should they be isolating longer?
Yeah. So the best evidence we have is that it's happening in a minority of cases. In clinical studies, it had about 1%, but we're seeing maybe in the real world that single-digit percent, could be even more. But most people, don't usually test, so we don't fully know how often this is happening. But it's still reducing your risk of severe illness. And that's what's super important. But even when these rebounds do happen, they're mostly mild or asymptomatic. I actually had a rebound myself. I was negative for 3 days and then tested positive, had some symptoms, but they cleared up. On average, we're seeing these symptoms clear up in about 3 days. So hopefully that's what we'll see here with the president. And yes, if you get that rebound, you have to restart the clock on isolation for another 5 days, unfortunately.
Could those rebounds happen sort of more long-term after weeks, let's say?
That's not likely. We're not seeing that. That could potentially be a reinfection. Unfortunately, this BA.5 that's much more transmissible. We're seeing this recurrence of reinfection. If someone had the BA.2 variant, for instance, but unlikely that it'll happen weeks. It's really going to happen in that sort of first week that you're testing negative.
All right, Dr. Brownstein, always great to have you. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.